Did you know that in Medicare Advantage plans have a lock-in period, meaning that once you enroll, you are locked in for the remainder of the calendar year? Yes, that's true. You can only disenroll at certain times of the year, such as during the annual election period that occurs every year in the fall from October 15th to December 7th. However, you also get a one chance in your lifetime to try a Medicare Advantage plan and be able to leave that plan and go back to original Medicare with no questions asked. This is called a trial right period. You might be asking, why would Medicare allow a trial right for Medicare Advantage plans? Well, for many years, Medicare beneficiaries have filled in the gaps in Medicare with a Medigap plan, like a Plan G or a Plan N. Because as you know, Medicare only covers 80%, and you are responsible for the other 20%. So taking out a Medigap plan fills in that gap. And that Medigap plan pays after Medicare pays. And these plans have provided very predictable coverage with little out of pocket on the back end, depending on which plan you choose. They also allow you freedom of access to any doctor in the country with no networks. But these Medigap plans have annual rate increases, just like most types of insurance. So over the years, these premiums can add up, making beneficiaries want to explore different types of Medicare plans, but they work differently. Medicare Advantage plans are private insurance plans. They pay instead of Medicare. And yes, they usually do have a lower monthly premium than a Medigap plan, but instead, you're going to pay copays and coinsurance for health services as you go along. And these plans also have networks of providers, and some plans will require you to choose a primary care doctor or get a referral if you need it to see a specialist. They're often attractive with benefits such as dental and vision coverage, transportation, gym memberships, over the counter cards, and other benefits. And some even have a Part B give back. But some of these beneficiaries, unfortunately, focus more on those additional perks than the really important benefits. So when they enroll, they rather than making sure that their providers are in the network and the built in drug coverage includes the medications that they take, they also don't often take the time to learn how the plan network works or what the plan charges for certain healthcare services. So they may then find themselves stuck in with a network hassle or requirements for referrals or prior authorizations that they don't enjoy dealing with. Or perhaps they join a plan only to find that their doctor dropped out of their network mid-year and now they need to go find a new provider. It doesn't matter what the reason. If this is the first time you have been enrolled in a Medicare Advantage plan and you dislike it, you can leave that plan anytime in the first 12 months. And you can return to original Medicare using a special election period called your trial right, and you do not have to wait for the next valid election period to disenroll. And there are two scenarios where this might occur. The first is when you first join Medicare Advantage plan right out of the gate when you turn 65. Then you decide to leave that plan in your first year. When you disenroll and return to Medicare, you'll be given an opportunity to get a Medigap plan with no health underwriting. They cannot ask you any health questions. So you can take the time and you can review all the Medigap plans that you are eligible for in your area and choose any company you like to qualify for. This trial right for your Medicare Advantage plan must start on the same day as your Part A and your Part B. The second scenario is when you have been on a Medicare plan with a Medigap plan, and then you decide to try a Medicare Advantage plan for the first time ever, meaning you've never been on any other Medicare Advantage plan before. You can use your trial right special election period to disenroll during that first year on that first Medicare Advantage plan. And you can return to the same Medigap plan that you had before with no health underwriting. This is a bit more limited though, because you can't apply to any Medigap plan in this scenario. And you cannot expect to skip the health questions. You can only return to your prior Medigap plan with your previous insurance company if you want to bypass the medical underwriting. Now, the trial right may sound great because most people want to save on Medicare premiums, and that makes them look at Advantage plans in the first place. The idea that you could try for a year and still be able to get back to Medigap without underwriting is pretty tempting. If there's one thing I want you to consider though, if during that 1 year trial you are pretty healthy and you don't use many medical services, you're unlikely to encounter some of the things that make people sometimes dislike their Medicare Advantage plan. It's when you have those health conditions that pop up or that require more frequent medical care that you may experience some things that sometimes people don't love about Medicare Advantage. So make sure that you know which medical services will be the most expensive if and when you encounter them on that plan, and do a little research. If you work with us here at SSG Insurance, we can help you compare your options and see what will work most cost effectively for your healthcare needs. Remember that if you have had a Medicare Advantage plan for longer than 12 months and you dislike, you can still disenroll during another election period, like the annual election period, like I discussed earlier, from October 15th to December 7th. Or you get another chance with a Medicare Advantage open enrollment window from January 1st to March 31st. If you can't medically qualify to get a Medigap plan at that time, you can switch to a different Medicare Advantage plan, hopefully with benefits or a network that you like better. Be sure to watch our Medicare Advantage pros and cons video next to learn more about what type of coverage.